I'm going to record this, by the way. Say it
Yeah.
again.
So there's some question about the reimbursement, the insurance.
No. More so, just like why would they do the test, and what do they do if once they get the results, basically.
Okay, so there is two testing in neurology. We have the pseudomotor function, with assess the C fiber for the small fiber neuropathy. Okay, and you have the cardiac autonomic function, which have different symptoms also, like fatigue, dizziness, and so there is a list of cardiac autonomic function symptom. For the pseudomotor function for the small fiber neuropathy is the pain on the skin. It can be tingling, it can be burning. There is a lot of symptom also. I can send you the list of the symptom if you want. This one is a medical necessity. Now, we cannot use, for example, a disease as a medical necessity. The diabetes is not a medical necessity. You should have a symptom. Okay. And there's not only the diabetics that have this problem, so it can be any symptom related to the cardiac autonomic function or the pseudomotor function. I answer to your question?
Helped, yeah.
Mm-hmm.
Okay.
And
Okay.
And for insurance company, you have the CPT code for the pseudomotor function and for cardiac autonomic function, and you use the ICD-10 according to the CMS. And on the software now, we offer that you can, the CPT code is the same for the pseudo and always the same, it doesn't move. And you can select in the checklist the ICD-10, which is a necessity. Okay, and this one come in the report also. Okay.
And then the question is, when they generate the report, what are the action steps? I guess, like what do they do once they have the report in terms of treatment and things like that?
Yeah, how does it affect treatment?
Mm-hmm.
We have nurse practitioners and physician assistant and doctors who order the test, and I guess they want to know, how does it affect the treatment protocol when you do the test?
Very good. So regarding the pseudomotor function, the interpretation is very easy because you have a value and you have the different step of the pseudomotor function. You can be in early step 1, step 2, or severe. Okay. At this point, you have the interpretation according to the value. The treatment, we have the general treatment that we use for the small fiber neuropathy that can be only vitamin or acid lipoic or even antidepressant. So depends at which step and the severity of the symptom. Regarding the cardiac autonomic neuropathy, depends the symptom. If it's dizziness, there is some treatment, there's a FDA treatment, or there is some other way, okay, to treat the cardiac autonomic neuropathy by the change of the lifestyle. I have a PowerPoint presentation with the interpretation and the different treatment that you have to select according to the symptom. Okay. On the software, I don't recommend any treatment, but in my PowerPoint presentation, there is a list of the different treatment that you can choose according to the symptom. I don't know if I can share my screen.
Yeah, let me make it so you can share it. Hold on one second. Go ahead. I may have given them these presentations. I'll have to see which one you're referring to now.
Yeah. Okay, I have to open it before to share it. Okay. Just 1 minute. This one. I'm looking for my presentation. I have so much thing in my
It's all right.
I
It-
have to
yeah,
find
I
it.
may have it too. If you, is it the 2020 wireless presentation or is it the?
No. It's a new one because now, okay, everything in on the cloud. We have a cloud, which is very, very good. You will see. I will make a small presentation about that. Okay.
You can send me this stuff too.
Yeah. Okay. This one is a presentation. Okay. Okay. So I pass the different steps and I go directly in treatment. Okay, so okay, here. Okay, so I can share now.
Yeah, you should be able to.
Where are you? Oh, here. No.
Bottom, just scroll down to the bottom. You'll see a share screen.
But I cannot share this document. No.
It's telling you know it. I've got it selected that you can.
I don't know why. Okay, I don't know why you are. I cannot come back in the first screen. Okay, just 1 minute.
Hold on. It might be host only. Let me see if I can figure out.
Okay. No. Go this one. But well, I cannot extend it. Yes. Okay. Share screen. Okay.
Oh, there we go.
Okay. Yeah, here.
Perfect. Oh yeah, I haven't.
So, yeah, I go in this one. So there is some treatment that we recommend from endothelial marker because you have also the endothelial marker. You have the ABI, okay, but this one is a regular treatment. Now for the pseudomotor function, okay, it depends the step that you are. You can have a C fiber inflammation or over response, okay. You can have anti-inflammatory cream. You can have also when you have a mild to moderate decrease of the pseudomotor dysfunction, you have the capsaicin, and so So we have the same for the cardiac autonomic neuropathy. It can be pharmacologic or no pharmacologic treatment. Okay, so depends the symptoms that you have. Is only fatigue, maybe you go in non-pharmacologic. If you have dizziness, according to the side effect of the treatment or dizziness, you can have some medication. Okay, but this one is what the FDA recommend. Is not don't come from us. This treatment in general treatment. And you have to make the link between the symptom, because I cannot do for you, and the treatment. Okay. Now I can share my screen with the cloud if I have access here. Okay, I show you how we have that now. Okay, you have my screen here.
No, Dr. Merrick, it's still just showing your
Okay,
document.
this one.
I think you may need to change your.
Yeah. So you are in the website now.
No, not yet.
Share my screen.
I think you're just
Now,
sharing instead of, there you go. Okay, perfect. Okay.
you have it? Okay. So I go physician portal. You will have, when you finish a measurement, anywhere you are, okay, you can be in vacation in a swimming pool and you can check that, okay? So you have the patient are coming directly to your cloud. Okay, if you are in your office, okay, you can check it because it's coming directly. Now you share that with a nurse or some vascular guy or other. I'm sorry, there is some noise. Okay. You have, I think, any patient, you can make directly as you can make directly your interpretation. So you have the guideline that you can open according to the abnormal result and all. You can have also the graphic, okay, or you can have the result, okay. So we go here, you have the result. We give you one interpretation and operation, but you can edit and change anything you want at this level. You can add, for example, additional examination. For example, you put the plasma catecholamine, you put the lipid profile, SB1IC, and the next visit that you want. You can have also some macro comments that you prepare and put it. So the interpretation is very, very fast, you know, and then you sign it because you are neurologist, but you can have also the vascular guy. He can make interpretation of the ABI. He can put one interpretation, and you share all that, and everything is updated on the report. Okay, so if I come back here, after you sign it, okay, you have the results, for example, in cardiac autonomic, and you can see the interpretation. You can print it, you can make everything you want. If you have a vascular guy, my interpretation for the ABI, the same. Okay, so the recommendation at this level, but you have a PowerPoint presentation. After that, you know how to manage that. The same for the pseudomotor function, and same for every item that we assess with the TM flow. Okay, so this one is the normal results with the not interpretation. Okay, it's clear.
Yeah.
And it's very useful because, first of all, you can do that from your office. You can check your patient later, make an interpretation, submit to, you have the possibility also, if you have a billing system, you share with them, and you can have the status is submitted, is paid, and that you can follow the reimbursement. And we give for each one, when you have the report, here, new report, we put this one, I don't know if it's selected. Okay, yeah, you have that, you have the CPT code. So we don't select any ICD-10 here, but if you select in the software, you have it automatically. So the billing
So the ICD-10 code shows up on this as well, Dr. Merrick?
Yeah, of course, but I don't put it. But if you put at the moment when you register your patient, you select it, it comes on the report, and the billing system have the insurance company have all and can submit that.
When is this cloud going to be available?
Right now.
Okay.
It's available, I show you.
Yeah. So can we how do we access that?
We started the marketing of this cloud 6 months ago. So, and this one is the last one. Is the last version. You can print, but you can make everything you want, and you can share with any partner. It can be a vascular partner, it can be the billing system, it can be a nurse. So,
is there any additional cost to use the cloud?
No,
okay.
There is no additional cost.
Okay. Okay.
Cool.
So I need to get a login for this because this may solve a lot of problems at Dr. Brown's office. So yeah, I guess maybe after the call, if you can have
I
Dan?
can give you one. You can create one access, but you need one NPI. Maybe the doctor can play with
Yep.
that. I put you 5 patient tests,
Yep.
without
Yeah,
him.
let's do that. And then does Dan also is Dan the one to train us on this, or?
Yeah, but the training is very simple because on the cloud you have everything to help you to make it to
Absolutely.
save, to change what you want, and after that you save, you sign, you go into the report, you can share with any department, the billing or maybe the vascular system for the ABI, or you can do it and
Yep.
what you want.
Got it. Okay, cool.
Okay.
And also, can you send this this PowerPoint to me,
Yeah,
please?
of course.
Okay. All right, guys, do you have any questions for him?
I think I get it. But if I do, we'll certainly get back. Yeah, if we get the PowerPoint, at least peek at it in this other thing, that'd be awesome.
Yeah, and then Dr. Brown, I'm gonna call you a little bit later, and we'll talk about all this stuff.
Okay. So
right.
I can prepare for you a fake clown, like with ID and password. You can play with that, and you can see 5 or 6 patients.
Okay.
It's a PowerPoint, and like this, you will see that maybe we don't need to speak anymore because it is obvious.
Yep, got it. No,
Okay.
I'll probably be able to figure it out.
It's okay?
Yeah,
All
thank
right.
you very much, Dr. Merrick.
Thanks. Bye, Dr.
Thank
Merrick.
you.
I'll call you guys. All right, bye.
Bye.
Bye.